Experts say that the third wave of COVID-19 will come soon. Although opinions regarding the vaccination of children as early as possible are varied, the prevailing medical opinion seems to be that children will not be disproportionately affected during the third wave of COVID. While the first and second waves were particularly deadly for infants, the middle-aged and the elderly, children and teenagers were rarely documented to have severe or life-threatening symptoms. Dr. Sreedhar, consultant neonatologist and pediatrician at Rainbow Hosptial, Hebbal, tells us about the third wave and childcare and clarifies several misconceptions about infection in the younger population.
So what does the evidence say? There was a large study conducted by the All India Institute of Medical Sciences, Delhi, along with the World Health Organization, where they took almost 10,000 sample sizes, 10,000 individuals from the community across 5 states. And now we have an interim data of close to 5,000 of these samples. So they basically looked at how many of the individuals included in the survey were actually positive for COVID antibodies. So if an individual is tested positive for COVID antibodies, it means that they were infected with the virus. So basically the study was to find out how many of these were infected. Probably that is why, if you look at the previous data, about 2 to 3% of the children were affected is what it says. But then when we did the zero prevalence study, it clearly says that less than 18 years and more than 18 years, the virus is not differentiating between people based on age. It's equally affecting children and adults. So third wave will be there. It is less likely that children would be disproportionately affected. But just like the first and second wave, we will see cases in children also. But fortunately, cases will definitely be mild in severity and the complications will be definitely less when compared to adults. So right now, Pfizer BioNTech vaccine, they recently completed a study in children between 12 to 15 years. And they included close to 2,300 children, and interval between doses was 3 weeks. 7 days after the second dose, they have demonstrated 100% immune response to this vaccine. And several countries have actually licensed the use of this Pfizer vaccine in children aged more than 12 years. But currently, the vaccines that are available for public use in India are Covaxin and Covishield. They are not approved for children less than 18 years. Now, what happens is before these vaccines receive a nod from the authorities for regular use in children, there are certain mandatory trials that they have to undergo. So right now, phase 1, 2, 3 trials are actually being done on children with these vaccines, especially Covaxin trials are already going on. AIIMS has started doing trials for children aged more than 2 years, and there are many centers are doing it for children more than 12 years. But the data of these trials is not out yet. So once we have data from trials of our currently available vaccines on children, then only we'll be able to say what is the efficacy and what is the safety. Although this is uncommon, so the answer to your question is, child can be simultaneously be having other diseases. But then we suspect this only in children with moderate or severe illness, fever continuing beyond 3 to 5 days, or if they become sick, then most clinicians do rule out other possible and other common infections, then we treat them.
Dr. Sreedhar concurs with the latest medical opinions that although there will be a third wave of COVID-19, it is unlikely that children will be disproportionately affected. For now, the best way to combat the spread of the virus, both in children and adults, is to follow the hygiene and sanitation guidelines issued by the Health Ministry and to get symptoms checked at the earliest possible time. Here's hoping that the third wave, whenever it arrives, will be less brutal and avoid children altogether.